Israeli government. Iris Mackler, Antoine Mariotti, and Cécile Galuccio report.
There's barriers, ribbons, and sometimes even padlocks. This district is a red zone, a coronavirus hotspot. It's been cordoned off, and so has its population.
We're going to visit the different roadblocks that there are in order to make sure that everybody is inside and nobody can make a movement in or out.
Even in ordinary times, Mea Shearim is a kind of enclave, an ultra-Orthodox community living by its own rules. Black hats and jackets for men, modest outfits for women. Traditional Jewish law governs all aspects of their lives. The birth rate here is an average of 7 children per woman. Many live below the poverty line.
The people inside the communities, they're very isolated. They don't have televisions, they don't have iPhones. So what is happening is our units are speaking to the rabbis and making sure that the rabbis get the message to the community.
For several weeks now, that message has been stay home, and if you go out, wear a mask. But this community generally listens to its rabbis and not the state of Israel.
What I'm going to do is we're going to drive through. I'm going to flip over the number of my vehicle, so it'll be a plain vehicle car, not a police car. So what happens is that they recognize someone in blue uniform, an Israeli national police officer, and they could possibly stone the car. There's a lot of tensions in the communities, but that is something that we've been dealing with for years. But now, during the coronavirus period, it's felt even more.
Pedestrians have to push through the crowds, but as you can see, it's almost empty. 2020 is shaping up to be a terrible year for tourism, one of Turkey's biggest economic sectors. And it's precisely for economic reasons that the government here has quarantined only those under 20 and over 65. Everyone else has to keep working from home if they can and on site if they have to. Turkey has few monetary reserves. The lira still hasn't bounced back from the 2018 currency crisis, and it's launched several military operations in the last few years. Turkey now has the highest number of COVID-19 cases in the region, but its official death toll is still significantly lower than in many other countries. To find out why, let's talk to Pınar Said, representative of the Turkish Medical Association and head of the Istanbul Medical Chamber. Thank you for speaking to us, Mrs. Said. The Turkish Medical Association, or TBB, has noticed that the daily number of deaths has more or less stagnated, even though the number of new cases continues to rise every day. How is that possible?
According to the recommendations given by the World Health Organization, there are 2 categories of cases. People who tested positive for COVID-19, but also those who are potentially infected. That's when all the clinical exams, MRIs, symptoms, etc. point to COVID-19, but the test itself is negative. The WHO has guidelines to care for both kinds of patients. The number of deaths in Turkey appears rather low because it doesn't include people who are potentially infected. It's become a standard procedure around the world. In many countries, they record not only those who tested positive, but also those who are potentially at risk. That's still not the case in Turkey. That's why we do not have numbers of the exact number of cases or deaths from COVID.
Hem ölümlerin sayısı hakkında hem de vakaların sayısı hakkında net bir bilgi sahibi olamıyoruz.
Why is it so important that we have a precise idea of the number of cases and dead?
Çünkü o zaman vakaların yaygınlığını görebileceğiz.
It allows us to understand how far the virus has spread. When we have precise figures, we can make future estimations, especially for health professionals who are specialized in public health. That way, clinicians have a clear view of the situation to take necessary preventive measures. That's why it's so important. It's also important to compare the trajectory of a country with other countries. And finally, it allows us to know the reality of the situation on the ground.
Bir de gerçekleri tam olarak bilmek açısından da önemli.
How would you describe the measures that have been taken by the Turkish government so far in the fight against this pandemic?
Our health system performs well in terms of healing patients. The situation is satisfactory with regards to the number of beds we have, the intensive care structures, and the treatments given. But what's essential during this period is to be sure that people don't get sick in the first place. Instead of counting on healing and emergency measures from the outset, we need to put in place preventative measures before then. We need to suspend all non-essential and urgent procedures for a period of 15 days. If we had done it sooner, we would have limited the spread of the virus. It's a question of resources. The professional chambers, the different political parties must be consulted and must participate in this crisis management. Unfortunately, this pandemic is being managed from higher up in our country. We have to get past that. That's the only way we can fight the virus more effectively.
Has reached nearly 21,000. France's public health chief has warned that the virus is still circulating at a very high level. Now, the pandemic has shown that foreign doctors are indispensable to the French healthcare system. They are now demanding more rights, like doctors who went to medical school in the EU.
Nesrine Mafoudi works in this COVID unit in a hospital in France. Like her coworkers, she's had to cope with the unprecedented spike in patients. But one thing sets her apart. She earned her medical degree outside the EU, meaning she doesn't have the same professional status as European doctors.
On travaille plus que nos collègues français par nécessité, parce qu'à la base, on n'a pas les mêmes salaires à la fin du mois. Mon chef de service me fait confiance. Il me considérait dès le départ comme un médecin. Donc je ne vois pas pourquoi la République française ne nous reconnaît pas comme des médecins.
Nesrine Mafoudi is not alone. Thousands of foreign doctors practice in France, often in less secure jobs with lower pay. But many of them have become indispensable, particularly at this hospital in the northern Paris suburb of Saint-Denis.
Beaucoup de services d'urgence ne fonctionnent que grâce à des médecins à diplôme étranger. Je pense que ces médecins-là ont rendu un énorme service à la France.
This doctor agrees. Amin Benyamina left Algeria for France in 1996 and knows firsthand about the struggles foreign doctors face. Now the head of psychiatry and addiction treatment at this hospital just south of Paris, he's become an advocate. He sent a petition to Prime Minister Edouard Philippe requesting better working conditions for foreign doctors.
On a toujours eu besoin d'eux, et on en continue à avoir besoin d'eux, et on aura encore besoin d'eux si le président de la République, comme il a promis, fera de l'hôpital et de la santé un chantier prioritaire. Ça ne se fera pas sans eux.
A healthcare law passed last year could make it easier for foreign doctors to be professionally recognized in France, but many are still vulnerable. Jean-Jacques Razafin-Dranazi, the first healthcare worker to die from COVID-19, was a foreign doctor from Madagascar.
Now there's more
of oil trading. We now have seen the international benchmark for oil prices, Brent crude, slump to its lowest level since 1999, and that's after we had the unprecedented move of US oil, WTI, slumping below zero early this week. Now, the latest on the oil markets is we're looking now at contracts for delivering oil in June. WTI down around $11 a barrel. That's the lowest. That's about half of what it was yesterday. And Brent crude having a significant slump today of about 10% in trading to around $17 a barrel for Brent. So what that tells us is that even in June, the oil markets aren't expecting there to be any recovery in demand. And this is a simple problem of supply and demand. There is too much oil in the market and not enough demand for it because of the shutdown that's affecting many parts of the global economy. What plunged US prices through zero this week was the fact that there was no storage left either for oil in the United States. And that's a problem that's now being reflected internationally too. So that's what's affecting, one of the factors that's affecting the price of Brent crude as well, as they're running out of oil tankers to store oil in as time goes on. Now, the prospects even further down the line aren't much better. Contracts delivering oil later this year don't see much higher prices, and that tells us that the recovery in this sector could be very slow because, of course, even when the economy picks up, there'll be this massive glut of oil already out there that will need to be consumed as well, filling up all of those storage tanks that we know are now near full too. And that essentially means that the expectations for the recovery in the global economy are pretty weak. Now, this is very bad news for the oil industry. Donald Trump has said his administration is looking at helping out the industry there as well. But really, until the economy picks up, we shouldn't expect any major recovery in oil prices, and they could go even lower.
535,342 tests have now been carried out in the UK, excluding Northern Ireland. Of these, 129,044 have tested positive. The number of patients in hospital with COVID-19 symptoms is now down to 17,681. 17,366 people have sadly died in hospital, which is an increase of 852. This number is another salutary lesson, and it tells us of the deadly nature of this virus. I'm today making available £20 million to the Oxford team to fund their clinical trials. The team have accelerated that trials process, working with the regulator, the MHRA, who have been absolutely brilliant. And as a result, I can announce that the vaccine from the Oxford project will be trialled in people from this Thursday. In normal times, reaching this stage would take years, and I'm very proud of the work taken so far. At the same time, we'll invest in manufacturing capability so that if either of these vaccines safely works, then we can make it available for the British people as soon as humanly possible. Nothing about this process is certain. Vaccine development is a process of trial and error and trial again. That's the nature of how vaccines are developed. But I've told Sarah Gilbert and Robin Shattuck, two of our most inspiring scientists, that we are going to back them to the hilt and give them every resource that they need to get the best possible chance of success as soon as possible. After all, the upside of being the first country in the world to develop a successful vaccine is so huge that I am throwing everything at it. Coronavirus is a powerful enemy, but I believe that the power of human ingenuity is stronger. Every day the science gets better, and we gather more information and we understand more about how to do.
Same thing in Paris near the Eiffel Tower. The Alps now visible from Milan. Another clear horizon in La Paz, Bolivia. Here, as in many cities around the world, the smog has cleared as the coronavirus pandemic imposes social lockdowns and economic shutdowns. Road traffic here has dropped by up to 90%, according to local officials, and scientists are paying close attention.
El corte súbito que tenemos de emisiones, como la otra vez una reactivación de esa emisión, nos va a permitir ver en qué tiempo, cuál es la velocidad de reacción del planeta.
Less cars on the road, less planes, and less ships. The reduction in road, air, and maritime traffic have all contributed to the improvement of global air quality. For some environmentalists, it's a sign that fighting climate change is possible.
What's happened kind of overnight or in a matter of days in light of the COVID-19 has really demonstrated that there's a lot more capacity for society to change very quickly, and right now we need society to change quickly and positively to tackle the climate crisis.
As certain parts of the world begin easing lockdown measures, some scientists fear pollution will return as countries look to reboot their economies amid the crisis.
That's it from me. Thank you very much.